He is expected to stop well short of the mission accomplished moment on COVID, Politico reports, that many members of his own party would like to see, stressing instead the need to remain vigilant against the virus. And they say, if you're waiting to rip off your masks, this is not that moment, said one of the people familiar with the planning. By the way, 70% of the country is now maskless, so I'm not sure how that can be the message tonight, but he's afraid, which no one's surprised at. A lot of people thought it was maybe Jill Biden really stoking his fears and making him so COVID crazy. Who knows? Dr. Jill Biden. Doctor. I, too, am a doctor. I have a Juris Doctor. I'd like you to refer to me that way. In fact, I forget to remind people. In any event, the Democrats writ large are preparing to take a victory lap on COVID and have completely shifted their messaging. You tell me whether it is an accident that the day before the State of the Union, the CDC finally comes out and says, okay, you can take the masks off in 70% of the country, with Micheal Knowles finally apparently willing to relinquish her hold on us, saying, we want to give people a break from things like mask wearing when levels are low, and then have the ability to reach for them again should things get worse in the future.
Megyn, how dare you question the science? Don't you know that the science says that the State of the Union is the cure to COVID, that it is the political science and the medical science follows the political science. This has always been at the heart of the COVID issue, is that people like Micheal Knowles, people like the exalted Dr. Fauci, peace be upon him, people like the other public health bureaucrats, they have pretended that they are merely clinical, scientific, scholarly sorts of people, when in fact they are political apparatchiks. They get their paychecks from the government. They make public policy for 300 million people, more than 300 million people, because their policy affects people around the world. The masks have always been a political symbol. Now, at least, we're allowed to say that the masks are little more than facial decorations, now that Leana Wen, the CNN medical analyst, has admitted that on TV. We previously were not allowed to say that. That would have been dangerous misinformation. But at the heart of this, there has always been the capricious and arbitrary use of power. That capricious use of power, the neurotic symbolism of the masks and all the rest of it, had previously served the Democrats' political interests. It gave them a lot more power, particularly during 2020. And in the lead up to that election. It's no longer serving their political interests, and so they're itching to get rid of it. As we were discussing earlier, Joe Biden does not have a single accomplishment, not a single one for his entire presidency. Everything has gone to pot on foreign policy, on domestic policy. The man can't even pass a budget. So he needs some sort of win. I think he's going to try to get that win tonight in a maskless sort of State of the Union. But as you can tell, they're vacillating. They go back and forth because the COVID lockdown gave them so much power. They even when they were pushed at the extremes, the Supreme Court, for instance, shut down the OSHA private employer mandate, but they took much more power on the healthcare workers, on government contractors, on the way we live our lives. And so they don't want to give it up entirely, and they're trying to have their cake and eat it too. And like most things this administration does, it's just probably not going to work.
You know, today, for the first time in 2 years, I sent my children off to school without masks. 2 years. My 8-year-old son was in kindergarten when they had to mask up. Now he's in second grade, and I resent these people. I do not accept Micheal Knowles and then have the ability to reach for them again. Keep your hands off of me and keep them off of my child's face. No one's listening to you anymore. You are a political operative. You made that clear so many times. One that comes to mind is when you refused to condemn Sonia Sotomayor, a left-leaning liberal jurist on the Supreme Court, for grossly overstating the number of children who'd been hospitalized, who were in the hospital at the moment, thanks to COVID, suggesting it was 100,000. It was an absurd misstatement of fact, and you refused to even correct her because you're a partisan hack. So, but here's what's happening, Michael. Now we're going into tonight, in advance of the State of the Union. Finally, even New York State, even California are getting rid of their indoor mask mandates, including in schools. I mean, it's like they've been holding on to that with their cold, dead hands. The House has dropped its masking requirement. The White House has dropped its masking requirement. All of this begins on March 1st, day of the State of the Union today. California, Oregon, Washington, all ending school mask mandates as of March 12th, trying to create this illusion that he can have a spike the ball in the end zone moment.
He is trying to. Unfortunately, though, Joe Biden has a habit of putting his foot in his mouth, and he already admitted a few months ago that there is no federal solution on COVID. Do you remember? He started his campaign. He said, I'm not going to shut down the country. I'm going to shut down the virus. And then what did he do? He shut down the country, and then he admitted that there was no way for him to shut down the virus. So I think that people have woken up to this. I don't think that the Democrats are exactly in control of this narrative anymore. You mentioned, Megyn, it's been 2 years, 2 long years of 15 days to slow the spread, which was initially to slow the spread, then flatten the curve, then find a cure, then take the jab, then stop the surge because there was a surge again because the jab didn't do everything we were told the jab would do, then slow down and then just keep going on and on and on. We were told that the vaccines would stop infection and transmission. That turned out not to be true. Then the story changed to the vaccines are going to minimize hospitalization and death. Perhaps they did. We were told that 2 would be sufficient, then 3, then 4. We were told we had to jab the kids, even though the kids are at low risk of the virus. Now we find out 5 to 11-year-olds basically do not have much protection from the coronavirus vaccines. Then we were told we had to mask to protect other people, then to protect ourselves. And then they've just totally lost the narrative. And so I think for them, it's probably best to cut their losses and move on to the next contrived crisis.
Hey, thanks so much for watching. If you like what you just saw, hit the subscribe button for more clips and full episodes.